Good afternoon to everyone. I hope you're having a wonderful experience at this World Pain Summit. It's a pleasure for me to be able to speak to you today. I know that you're members of multidisciplinary teams that provides not just treatment, but also preventative services for patients and clients who experience all forms of pain. So thank you to the Pain Society of Alberta for this invitation, for organizing this large and well-attended conference, and for partnering with Alberta Health Services through our strategic clinical networks, which Rob had already mentioned. Over the last 4 years, the Alberta Pain Society has been working with us on the Alberta Pain Strategy. And this is really one of our first, what we would call a pan strategic clinical network effort, and really highlights how effective partnerships can be when you look at involving stakeholders and looking at the entire health journey and continuum. So look forward to seeing the continued success of this work. And I also want to take this opportunity to thank all of you for your flexibility, ingenuity, and dedication through this pandemic, because responding to this COVID-19 20-month saga has been really grueling for all of us. This public health emergency, I think, is one that none of us wanted to see, but is here with us and continues to be with us. And I think we all want to see it go through the finish line instead of being in the throes of a devastating fourth wave. So the pandemic, needless to say, has been emotionally and spiritually draining, physically draining. We've had a lot of losses, which continue to mount. And when we think about all the losses and the sorrow and the illness and the isolation and the stress, there are some silver linings. It's not a rainbow perhaps, but there are some positive things that have come out. And within Alberta Health Services, at least, I think one of the things that it really has helped us is really firm up the concept of what we have in our system, which is the integrated healthcare system. So one where it's not just about the health organization, but it's really about working with social agencies and other levels of government coordinated programs and resources to make sure that all Albertans, including the ones who are most vulnerable and marginalized, have equitable access to healthcare services. So really couldn't be more proud of the work that we've done in Alberta Health Services, but also our partners, including the Pain Society of Alberta, and how we've worked together to respond to this global health crisis. I think one of the things that we've done across the world is really about following evidence, which seems to almost change daily. And it really has forced our hand to be able to change, not just constantly, but also quickly and nimbly. And in Alberta, we have about 800,000 plus Albertans who struggle with chronic pain. And I know that one of our biggest challenges during the pandemic was in the ambulatory care areas, and actually in many of our acute care programs where we had to either pause or reduce clinical activities during the initial COVID-19 response. So we did a lot of hard work to minimize the impact of the pandemic restrictions on people trying to manage chronic pain. Strategies were quickly developed to stay connected with patients virtually or through specialist consults. And even when many of the patients and clients were required to work from home, the use of virtual health really helped ensure that patients could still be connected, meet and consult with their healthcare teams, even when physical distancing measures meant that they couldn't be in the same room. And so, you know what they say about the necessity about being the mother of invention or innovation in this setting. It turned out in many instances, the new ways that we were forced to deliver care really turned out to be better ways for the people that we serve. So for example, in Calgary, the Chronic Pain Center heard from patients and families who made it really clear that in many instances, they actually prefer the virtual health options. Rural patients told us that they thought virtual options offered improved accessibility because they didn't have to drive for some, that meant hours, to attend maybe a 15-minute in-person visit. And others noted that virtual options really reduced their financial barriers because they didn't have to worry about the cost of transportation or taking time off work or having to pay parking on the site. And many chronic pain patients, especially those who also have fatigue and or mobility issues, said they enjoyed more physical comfort attending Zoom groups because they could better accommodate their own needs at home. And then we had other patients who remarked that the virtual options offered them more flexibility in their schedule, as they could stay at their work offices and join the sessions there as opposed to commuting to a site. So this is all very welcome feedback and a credit to all the healthcare providers here today and your ability to maintain continuous care, even during a global public health emergency. So huge kudos for all of you as you continue to strongly advocate for chronic pain patients and their unique healthcare needs during this difficult time, as well as for continuing to develop a coordinated approach to chronic pain management, and in our setting through the Alberta Pain Strategy. As I've mentioned, you've introduced and increased access to care using virtual means and continue to collaborate to offer seamless access and flow for patients through primary, secondary, and tertiary levels of care, depending on the complexity of the care needs. But we know that you've also launched working groups specifically focused on improving access to interdisciplinary pain care and resources, including developing a provincial model of care for chronic pain. Collaboration between clinicians and patients resulted in creating these comprehensive care plans for those who require chronic long-term opioid therapy. So thank you for that. In addition, development of an evidence-informed online repository of pain management resources for patients, public and healthcare providers, as well as an optimal outcome measurement framework for chronic pain. And then testing a digital solution for managing surgical patients at risk for transitional pain in order to prevent the development of chronic pain. Guidelines, a review of guidelines and protocols for acute and chronic pain within Alberta were also developed. And with the support from Campus Alberta Neurosciences, the 𝐒𝐔𝐁𝐄𝐑𝐈𝐁𝐄 Brain Institute, and many others, the Alberta Pain Research Network was created, which is going to build critical research capacity for transformative discoveries in fundamental and clinical pain research with a focus on improving the treatment of all pain conditions. In addition to that, there have been virtual education sessions like Let's Talk About My Pain, looking through the lens of virtual pain care, and Let's Talk About Migraine. And all of these events have had record attendance. So really the commitment to working on the development of the Alberta Pain Strategy with the aim of achieving excellence in pain management across the lifespan for all Albertans. I can't thank you all enough for this. To all the healthcare providers here, your ability to adapt under challenging circumstances has really been extraordinary and inspiring. And to the people here who are managing chronic pain, thank you for being here and for sharing your insights and lived experience with us so that we can better understand what matters most to you and how we can do a better job serving others with chronic pain. You may have heard me say before that healthcare is a team sport. And when we think about a team, we're not just talking about team within the inner circle of the healthcare system, but we're talking about healthcare providers of different disciplines and specialties, but we're also talking about patients, families, clients, and it is also about external partnerships such as that with the Pain Society of Alberta, as well as Albertans who work with AHS. So again, thank you for the opportunity to be here to speak to you today. Thank you for all that you do and continue to do. I hope you stay well and stay safe throughout this COVID-19. Please enjoy the rest of the Pain Society of Alberta World Pain Summit. And back over to you, Rob.
Thank you so much, Verna. And in reality, it is because of the support of Alberta Health Services that we now are internationally recognized for Alberta Pain Strategy, for our research network, and for everything that is happening in the province of Alberta. Are there hiccups? There's always hiccups, but we couldn't do it without Alberta Health Services and the leadership of Dr. Verna Yu and Tracy 𝐒𝐂𝐑𝐈𝐁𝐄, who has really shown an incredible desire to take this to the next level. And truly, that's where we sit. A big thank you to you and to the support that you have provided to the Pain Society of Alberta in order for us to help so many people become empowered who are living with pain, both by education for their healthcare providers and for themselves. Thank you so much, Dr. Yu. Have a wonderful day, and thank you for being here with us today.